Okay, so hello there. We are recording our webinar today. So my name is Mara Shorr, and I am one of two partners with Shorr Solutions, your very favorite practice management consulting company, your prescription for success. And I am here today to moderate this amazing webinar, this amazing conversation that truly I'm more of a just introducing here. The person that's going to be hosting is Jay Shorr. And so Jay, raise your hand. There we go. Jay is
Jay here and present.
Yes, perfect. Perfect. You're ready for school.
I'm ready for school.
And so Jay is not only our founder, but he is my business partner. And as you can see from the very similar last names, identical last names, Jay is my father. So for those of you that may not know,
front and foremost, by the way.
Yes, first and foremost, we are a family-owned and operated practice management consulting company. So Jay is going to be speaking today with Rick Conn. Now, we have had the pleasure to work with Rick before, and when it comes to discussing OSHA, we said this is somebody that we want to speak with. So Rick, raise your hand. There we go. Rick Conn is the CEO and co-founder of Universal Healthcare Consultants. Rick, as you can see, is also a guitar enthusiast and may or may not have shown us some pretty cool and signed guitars before y'all joined us today. So I am going to let these two gentlemen lead the conversation. You'll see me hop off my video in just a moment. In the meantime, what I want to do is just let everybody know that you are able to, for those of you that are live, ask any questions that you have in the chat function. I will be here in the background, although my video will go away. I will be here in the background to help make sure that the panelists have your questions, your burning questions, ask them as we go. We are here for you. For those of you that are on live, I would also ask in the chat function right now, open up the chat function, and let us know what type of practice you're with and what your role in the practice is. So is it a surgical practice? Is it a med spa? Are you just opening? Are you moving and grooving and you've been going for 15, 20 years? And also, where are you based? So let's talk about that. Since this is being recorded during COVID, I always like to ask, is your practice currently open or not? Because we know that this changes day to day. So let's get moving and grooving. Jay, I am going to turn off my video and let you take it from here. So see you on the chat function, guys, and you'll see me all the way at the end.
Okay, thank you. As I love to always hear, together forever as one. Let's get started. Okay, so Rick, it's a pleasure to see you again. What we're going to do today is we're going to discuss the relative importance. We all know the OSHA, Occupational Safety and Health Administration guidelines, regulations, and the stronghold that OSHA plays in not just our business and our industry of dermatology, aesthetic, cosmetic, facial, body, plastic surgery, and all of the other industries that it governs, but really people never really understood OSHA before. They heard the letters. They only felt that OSHA were I'm here as the government, we're here to help. But yet they always got freaked out that OSHA is the police department. But now in this era of our normal, I want to get away from that new normal, our normal, people have become more accustomed to hearing what OSHA guidelines are and the requirements of PPP and PPE. And you know what? We'll speak about this, Rick. PPE is nothing new. It's stuff that we in operating rooms have had forever, but all of a sudden they have this new buzzword, PPE, because it regulates what we should be wearing and what we should be doing. But for the sake of our conversation today, I just want to have some dialogue with you of the relative importance of OSHA, not just during COVID, but well into beyond. It was the before, the current, during, and well after this, what regulations, what governs, what record keeping, who is a part of it in our medical practice, in our surgical, in our operating rooms, for OSHA regulations and guidelines. And for those who will be tuning in and listening, our slide presentation today is only going to be some of the questions that Rick and I are going to discuss. But for those of you who want an actual OSHA PowerPoint presentation of sharps and biomedical hazardous waste and the things that govern OSHA and things like that in our workplace, all you need to do is send me your email and a request that you'd like to have an OSHA presentation. It will not be this presentation. This is going to be available additionally to that. But the slide presentation for today, as I just said, is going to be nothing more than just having the questions and answers. So let me start to explain, Rick, with you and OSHA and things like that, what are the actual guidelines of, this is going to be a bifurcated question for you. Number one, who needs to be trained in OSHA and when? Let's start off with our current and existing practice, and then while we get new employees. Who? Should we go through the who, what, where, when, and how, and why? Or let's just go through who, and then talk about the new employees that come in after that.
Sure. Every employee in a healthcare, well, first of all, I want to thank you for having me on today. And I'm very happy to speak about it.
I actually thought I had Mick Jagger when I looked in the back, but then I realized it was Rick Conn.
So, thank you. So as far as who needs to be OSHA trained in the healthcare setting, every healthcare worker needs OSHA training because everybody has a potential for exposure. The front desk receptionist, all the way through to the RNs and the surgeons themselves, they all need to be trained on OSHA. How frequently they should be trained is annually. The requirement is annually. We also train if there's an event and then upon hire. So to answer all the questions at once, we would train somebody upon hire. We would then train them annually thereafter, or if there was an event.
That's great. Explain an event, because many of the people that will be listening into this are non-surgical, all right? And they do events.
Okay.
They do laser events, they do Botox events, and I know that's not what we're speaking about. So describe an OSHA-related event.
Sure. So a med spa, for instance, that does injectables, there's a potential for exposure. And what we mean by exposure is they could be touched with the needle that had been used on a patient. Very often, sometimes we move a little quickly. We're not aware of our surroundings. The doctor may turn, you may be standing there, and he just kind of scrapes you. So in that instance, that would be an exposure, that would be an event. That would be an event that needs to be handled according to the OSHA standards, as well as workman comp standards. And after that is when we would do the retraining to investigate why the exposure happened. Other events that could happen could be spills. We're not aware of different spills and what the material may be or what the item may be on the floor. It could be water, it could be bleach, it could be caustic, it could be benign. But
blood.
We have, it could be blood. And then we go into the bloodborne pathogen standard, which is also part of the OSHA. So not only do we have PPE, which is personal protective equipment, but we also have the bloodborne pathogen standards as well.
Good. That's going to lead me in. Now, every question that I have will lead me into another question, naturally, because that's what webinars are. That's what the education and the training is for. Now, you know, you brought up a very good point, and people refer to me as Jay, the safety guy, and it's not something that, you know, I take very lightly. I've been in safety all, and I mean all, of my adult professional career. I was a senior executive with a major corporation in safety, health, and security, and I was the safety guy. So I take it very, very serious. It's not just talk that just happened right now. As a matter of joke, my first email address on AOL, it's embarrassing to say how far we go back, right, was please be safe, all right? Because I've always been that safety guy, and it's going to lead us into workers' compensation, which is different than OSHA, although OSHA kind of promulgates workers' comp on certain occasions because there had to be sometimes an OSHA-related event. We hope it's not always OSHA-related event that promulgated the potential for workers' comp. And then I'll get into the recordable versus reportable on the OSHA 100 versus the OSHA 300 and when all that has to get done. But name all the different types of training. Uh, as a former practice owner that had a dermatology, facial body plastic surgery, cosmetic plastic gynecology practice, we had AAAHC level 3 ORs. And I do want to make a disclaimer here. Many times when I say I had a medical practice, the disclaimer that I do want to make to everybody is that I am not a physician. All right, because it's important that people will think, you know, I speak about my former practice and everything, but I really want it to be known. I was the practice administrator, but I've been in medicine all of my professional career. So with that disclaimer out of the way, I want to talk about the different types of training that needs to be done, even though everybody has to do it. And then upon a new hire, how soon after the new hire, what OSHA training needs to be addressed in the medical practice. You did mention bloodborne pathogens and PPE, but there are several others that your company trains on and you have on your training platform and that you provide for clients. And we'll get into what you do at the very end. But what types of training have to be addressed in the medical practice?
There's also infection control standards, which go along with patient safety and the OSHA bloodborne pathogen standards. Patient safety and the infection control standards are really the umbrella for everything. So, you know, if we're doing things properly, if we're taking our time, you're not going to have an exposure because everybody is performing their functions in the manner they're supposed to be performing it, and everybody knows where the other person is supposed to be. It's when things get a little crazy and we don't have those protocols that these exposures will happen. But we do, but infection control is with that. That's why with the front desk person, okay, I had stated in the beginning that the front desk receptionist needs to be trained in OSHA standards. Why? Because you can have an exposure from somebody handing you a pen, that they have an abrasion on their hand. Hepatitis is very, very transferable. Okay, so it will live on a dried surface for 7 days. A lot of people don't understand this. If you look at just your, on the turnpike, if you go to the restrooms, there's no more doors. Everything is handless. So you walk in, you wash your hands, you leave, you don't have to open a door, you don't have to touch anything. So infection control is really one of the biggest things. We also talk about risk management, which goes along with the patient safety and the infection control. So those are the really, really big topics that we cover in our trainings. We also cover HIPAA, but obviously HIPAA doesn't go so much with the OSHA and the risk management and the work comp trainings.
Okay, so, you know, let me expand on that a little bit, because coming from the safety world, every practice has to deal with hazard communications in the 29 CFR. I don't like to get boring, but the CFR is the Code of Federal Regulations, and then section 1910. Everybody always laughs at me. I come from the transportation safety industry, and it was 49 CFR, and they have all these different numbers, but 29 CFR, which governs OSHA as it relates to us in HAZCOM 1910, talks about the different types of hazardous communications as it relates to OSHA as well, because we all know that we have hazardous materials. Now, people don't understand. You have to have the difference of material safety data or material data sheets now, which talked about health, flammability, and reactivity. And what happens when you have an exposure? Because you mentioned spills. Now, in HAZCOM, with training with OSHA, it's talking about if you end up taking one chemical or one substance from its master container from which you buy it, alcohol, peroxide. We do this all the time. You know, we take it from the big bottle that we buy from our supply vendor. I'm not going to mention any supply vendors' names. And then we take it, we put it into these little jars that we put into the exam rooms. Now, look, we know the difference between iodine and alcohol, the color. But does the person that has the exposure know what's in it? And then, of course, under the hazard communication rule, there's a relabeling rule, all right? And then you have to have the material data sheets for health, flammability, reactivity, because in case there's exposure. Would you like to talk about that a little bit? Because after that, I want to get into the laser safety.
Yeah, so what it's called now actually is the SDS, the safety data sheets. And you are required, every office is required for every product that they have in their office to have a safety data sheet. It can be electronic, and there are services where you can sign on and electronically have a portal to all of your safety data sheets, or you can contact the company. There's an 800 number on every bottle, every manufactured product that you can contact, and they will send you the safety data sheet. They'll fax it or email it to you. It is required to have. The one thing that we do tell our clients is you have to almost be a scientist to understand those things. So more important in our opinion, more important than having the safety data sheets is the product labeling when you take it out of the manufacturer's container. The proper way to label is with the manufacturer's name, what the product is, and what the hazard is. So alcohol, for instance, is for external use only. So it needs to say isopropyl alcohol if it's 90%, 60%, 70%, and then for external use only. Okay, and what we recommend is if, let's say, for instance, mom brings her child while she's having a medical procedure or service being done, and the child is walking around and he gets into something, and we don't know what it is. Well, firsthand, we're going to know what it is because the bottle has been labeled correctly. Okay. Second is that if the kid, I said he probably going to be a little boy that does it because I was that precocious little boy at one time. But what we would do is we wouldn't even look up the safety data sheet to find out how to treat that boy or that child. I'm sorry. What we would do is we would just call poison control, but we would have all the information right there. Just so everybody knows, poison control is a wonderful resource for anything. You can describe to them a pill that you have no idea what it is. Every medication, every pill is made specifically and it's registered. So if it's a blue pill that's octagonal, if it's got a score on it, if it's got a number on it or something, you could call poison control. So we always recommend immediately call poison control and they will tell you exactly what to do. Much easier than trying to decipher through the SDS, although the SDS is required.
One of the major things is in the event of an adverse reaction, contraindication, or an event, as you say, that safety data sheet, the beauty of that is it's something that you can either copy, fax, put online, send with the emergency personnel, 911, the first responders that come to say this is what the person came in contact with, and they'll know how to treat it. Years ago, you're in Florida, so you'll understand what happened was with Photox. The chiropractor that was injected with this phony Botox many years ago in South Florida, the only reason that those people's lives, that the doctor's life was actually saved is because the hospital knew what was injected, and that when there was a paralytic, and because it was the botulinum toxin, it was not Botox, that the hospital knew exactly what it was, so they knew exactly how to treat it. Hence, the importance of the safety data sheet for health, flammability, reactivity, so that people know what to do if you're not in contact with poison control. So where do you keep this? How do you get these services? And what are the record requirements when you have this type of a reaction as far as OSHA? Now, I know, having been a AAAHC operating room, and we have these different protocols in place, your company and risk managers actually provide your client under your guidance, tutelage, and contract with all the different instructions, because you mentioned protocols. Most people think they know what that word means. Can you share, because we work with all of our clients around the country, and we actually will write protocols because they are generic protocols, but everyone uses different types of materials and different instruments. So share what a protocol really is.
Sure. A protocol is just a step-by-step instruction on how to achieve what it is you're trying to achieve. And it will tell you. So in other words, if we're going to discuss a protocol for removing bleach from its manufacturer's container into a secondary container, we're going, and we want to dilute it to a certain, a 1 to 10 solution, just so everybody knows that bleach to water, 1 part bleach, 10 parts water will kill everything. Okay, and it's not caustic on your surfaces. And so you can remember that with the COVID that's going on, if you're trying to disinfect your house, your countertops, whatever it may be, spraying bleach 1 to 10, it needs to stay wet for 10 minutes. And we should discuss the wet times on certain products as well, just for the people that are out there, so they can understand the best way to sterilize and infection control. But we, you know, as far as, I'm sorry, tell me the question again. I lost track.
No, that's okay. No, actually, I want to move on to another couple things about, we're talking about exposure, and we're talking about bloodborne pathogens. You know, I want to move on to sharps for a second,
Okay.
because what's very, very important about that is when you're red bagging, and for those out there understand red bag, they call it red bag because it's that red bag that goes in a kick bucket, the red bag that lets you know, indicates that you either have blood soaked, or sharps can go in sharps containers, so that it's different than a trash bag. All right, so there are many things that people try to say, well, is that OSHA regulated, or is that Quad ASF or Triple HC? Is that regulations under the governing body of the, in Florida, you have accreditation, you have regulation, you have registered, they're different, all right? So whether or not you're AAA HC, Quad ASF, whether you're JCO, whether you're state, whatever, can you explain why we need to have these sharps regulations, and what goes into sharps, what goes into the red bag as far as OSHA is concerned, and as far as the regular governing bodies?
Well, the biomedical waste rule for what goes into the red bag is it must be saturated. And we personally feel that that's a little bit on the ridiculous side, because blood-soaked gauze is blood soaked, and we don't want to put that into the regular garbage. So we tell everybody anything with body fluid, anything that has been used on the patient, we put into the red bag. It's the sharps that's really more important. And a couple of years ago, OSHA came out with the Needle Stick Safety Prevention Act. Okay, and that was when they were starting to get a lot of needle sticks and exposures that we talked about before. And the whole purpose was, you know, and this was brought on with HIV and, you know, the infectious diseases. So what they came up with was a rule that said you have to have safety needles, safety devices, but it's not the administrator nor the doctor who decides the safety devices. It has to be the person who's using the device, and it cannot be determined by cost. So over time, they've redeveloped and come up with a whole multitude of different safety devices that needles are far less used. I don't know what the percentage is, but needles are far less used. Actually, if you look in the hospitals, your IV starts, all of the different uses that we used needles before, now they're screw-in type devices. As far as the sharps box, the one thing that we see a lot of is there's a line on the sharps box that's pretty far down from the top. It's only 3/4. And you're laughing.
What about that wasted space at the top?
Exactly, and the administrators and the owners of the facility and the doctors, they look at that and go, but this is costing me a lot. It's for a purpose, and the purpose is that when you put in that needle, you want it to be as far down as possible so you reduce the potential for an exposure. I will tell you that we have heard where OSHA has gone in and inspected different offices, and they've actually pulled out the needles that were above the fill line. And this facility was fined for every single needle that was above the fill line, because every needle was a separate violation.
But like trash can, if you step on the top, it'll make it go down, right?
Exactly. Only if you have a Kevlar glove can you do that.
For the sake of a disclaimer here, that was a joke, by the way. It may not have been funny, but I'm not professing to do that. Can you talk about the red bag, the HAZCOM, the sharps, about labeling of the containers for biomedical hazardous waste? I call it the cradle to grave law. And we'll talk about the generator and the transporter, generator being the one who generates the waste, transporter referring to the one that takes it away versus sticking it in your trunk and taking it somewhere.
Right. So every biomedical waste is tracked from when it's generated to when it's disposed of. And there has to be a trail of it. So every medical office has a biomedical waste contract. There's biomedical waste standards that they also have to have. They have to show training. This is part of the OSHA and the biomedical waste PPE training. So that's required under their guidelines as well. And they will come in and inspect annually. And so what happens is that you generate the waste. The pickup company, they have a contract with you. They come in and they pick it up. They give you an invoice for that waste. The boxes, the sharps boxes will usually go into the red bag, into the big cardboard box, but they do need to be labeled. So it needs to be labeled with your facility name and address. And so there's the box, and this way, and what happens is that if they find this on the beach somewhere, they're going to track it, and they're going to track it to the facility, and the facility is going to show that it was picked up appropriately by the transporter, and then they go talk to the transporter as to how did this end up where it shouldn't have ended up. And so that's the whole idea of the tracking from generation until incineration.
So hence cradle to grave.
Yes.
All right. I do want to add something on to what Rick just said. He said that when they come in, they will leave you an invoice. Depending upon the type of the company or transporter that takes it away that you deal with, they may not necessarily leave an invoice. Some do. They will leave you a manifest. That's a guarantee. Now, sometimes when you get your invoice at the end of a month, it will track that manifest number onto the invoice that says manifest number X was picked up, and it might be a 4 cubic foot box or 4 cubic feet boxes or whatever, so they know how to charge you versus what your contract called for. Some may leave it an invoice for that individual box that was picked up. Many, I don't want to mention any names here because this is not sponsored, will leave you in Florida, it's the gold one or the what they call it, canary or something like that. Now, it's very, very important to note that I will speak for Florida and some of the other states that what happens is you apply, it is through your county, it is state requirement of the biomedical hazardous waste, and they do have an inspector that comes out from the county and the state, and they look to see that you've got the license. First of all, you have to have a license, all right, as the generator, and then you have to be able to show that you've got a legitimate transporter, which are those manifests. And you keep that so you can track that your waste was actually picked up, all right? Now, can you speak about the inspection process that you may or may not get an audit from somebody? Because you did speak about being able to come in and physically pick out a sharps or a needle.
Right. So very often the inspector for the biomedical waste will not come in and do a physical inspection of the facility. Truthfully, all they're really looking for is to see that your staff has had their annual training. They will review your training and make sure that your staff has, that there's a sign-up sheet or certificates for each employee. They will review your invoices, the goldenrod invoices or the canary yellows, however we term those. And then they will also just make sure that you have a copy of the law and are aware of it. In order to be inspected as this other office was, there was an event that triggered that. So as long as there's no events, the inspection process is going to be very simple. The inspector will walk in, you will show them your binder of your policies, your law, your pickup receipts, and a copy of your biomedical waste permit.
Perfect. Leads me into the next. That's great. Oh, that leads me right into the next question that we just showed. How do you document and what do you document? I know that I have used healthcare consulting companies and risk management teams like yourself, and they would come in, and although I am very, very knowledgeable about OSHA and safety training because of my prior history and career, in my operating room, I actually did hire a third-party risk management company to be my risk management company and help with accreditation. And first of all, I felt a couple of different ways. Number one, I'm too close to it, all right? And that will lead me into, let's come back, Mara, let's come back to us. So I want to ask Rick and the documentation portion. The reason that I actually had a risk manager to come in and do that training is because I'm too close to it. And, you know, it's like if I ask Rick if I had little children, which I don't, you'll see how old my child was. That was Mara who came in earlier. If I had little children and dad is trying to explain something to them, it's going to be like the eye roll I get, right? But if I have Rick come in, and Rick is another parent or another professional, and you're going to give an opinion of something, I don't know why, but somebody else has more credence than dad. All right. So what documentation, when you do training for your clients, and we have the same type of a client, although we do not compete with one another, what documentation do you have when you do the training? And now you've got some wonderful online platforms.
Sure.
So what training docs do you have so that in the event there was an event and now you get a friendly visit from OSHA, because you're never going to have to prove your documentation unless somebody asks you for it. What documentation do you need? How do you store it? And where do you provide it?
Well, to go first to your first question of having an outside consultant versus somebody inside providing the training, what we've tended to find is most offices are not like yourself. They just want the training done. And what we come across a lot is individuals who are shy. And, today is this is the best time ever to discuss this, because you have people out there that are discussing whether they should wear a mask because of the COVID, but they don't want to wear a mask. And there's a certain ego factor or embarrassment factor when you're doing things. So what we tell people in the facility, if we were doing training in your facility, and I would explain to them, I don't know if that's water on the floor. So I'm going to put on my gloves, I'm going to put on a fluid resistant gown, and I'm going to treat that spill as if it was bleach, as if it was an acid or a caustic substance. And it may be water, but I'd rather err on the side of caution. What we find is that during the trainings is that a lot of people will come up to us and say, thank you so much for saying that, because, I was a little bit embarrassed. I didn't know, should I put on all of my garb? And when you explain it in this way, and you brought up children, when you explain it this way, when you're a healthcare worker, you encounter a lot of different people, and we don't know what they may have or not have. A lot of these people are sick. Most of them are healthy in our arena. We're talking med spas and plastic surgery, but we do have some facilities that are interventional radiology, interventional pain. And when you go home at night, you don't want your little child running up to you and going, mommy, mommy, daddy, daddy, and giving you a big hug, and you don't know what you have on your clothes. So if you don't protect yourself when you're in the office working, how are you going to protect your family when you go home? And that's a very, very important part of this whole thing, is getting over the fear factor, the
embarrassment. I think
embarrassment. Thank you.
I think there's more of that in the past than there is today, because I think more people are accustomed to now. It's not just you. You see more people out there. I mean, the only places that I go anymore is I'll put a commercial plug out there, even though it's not an endorsement, it has nothing to do with our industry, is the drugstore and Costco. And you know what's very funny about it is I changed my drugstore to Costco, so that when I have to go for my monthly statin or something like that, I make one visit. And when I do it, I go big. I mean, I go bigger and then I go home. All right. So I make the least amount of calls that I have to. But let's get back to documentation.
Yeah. So
how do I document it?
So you do this just as you would do any continuing education. There's a test. We explain it. We explain the OSHA standards. We explain PPE. We explain when it should be worn, why it should be worn. We explain the dangers, and then there's a test. And the test is what documents from the test. They get a certificate, and they have successfully passed their OSHA training for that year.
All right. And where should that documentation be stored? Let's just say, for example, and this is important because, like you, our clients are under a contract. All right. And we have a contract for a certain period of time, but let's just say, for hypothetical purposes, that my contract ends with you in September. and I have my training in July.
Mm-hmm.
All right. Now I don't renew my contract. I see you smiling. You know where I'm going with this. It sounds like it's happened before, right? Yeah, everything that we're going to talk about has happened before. That's why we bring it up. But let's just say I cancel or do not renew. I don't cancel. I don't renew because you got me to where I need to be, and I don't feel the need for it, although they do, because you need annualized training. What happens to that training? Do I print that certificate for my documentation, or does it live online?
So the interesting thing is that your biomedical inspector is not going to want to look on a computer. He's kind of like you and I, dinosaurs, okay? He wants to see the book. So what we do is we provide the book. And in that you have dividers. And again, in the first section, you're going to have your law. The second section, you're going to have your trainings. The third section, you're going to have your contract. You'll have a copy of your biomedical waste permit in there as well. And you're going to have copies of your annual training. And at the end of the day, you're just going to take that book and give it to the biomedical inspector, and he will thumb through it and see everything that's there and go on his merry way.
That's the bio inspector. Now, naturally, that's just one facet of it. For example, there may be the OSHA inspector, and you usually will never see an OSHA inspector or auditor unless you've had an event that causes that, or a whistleblower. That, and it has to be a pretty egregious that they feel that you're putting the risk and the safety and health of the other people in place. But
I can tell you that in 20 years of doing this, we've only had one instance. I've never had an OSHA inspector come out and inspect, but we've only had one incident, and that was a mercury thermometer broke in a doctor's office, and they had to get hazmat to clean it up because that obviously is airborne. It's very dangerous when mercury spills. And that's the only event ever, but still OSHA themselves did not come in and inspect. So yes, it would be an egregious event for them to come in.
You know what makes me laugh about what you just said? As a young child, I remember going to the dentist and they used to fill teeth with mercury.
Yeah.
I remember the dentist giving me a little droplet of mercury, and I took it home and I kept trying to squeeze it right. And you can never pick it up. And you look at it today and you say, how would you ever give a child mercury to take home? Are they going to drink it? Are they, there's just a different world out there today.
Well, that's why with our kids, they know we're better parents because we don't let them play with mercury.
Yeah.
Our parents did.
That's funny. Okay, so let's talk about OSHA training, which we didn't get into, and that is OSHA training and or awareness of lasers, because people are so unaware, because every one of our clients, whether it is a med spa or whether it is a dermatologist or a plastic surgery practice, all right, all have lasers. And the lasers are of all different fluence levels, anywhere from radio frequency to CO2 assisted RF to physical lasers, 532, 1064, and then you have the different ones for the alexandrite, you have the different ones for the YAG, and yet they all have one thing in common, the lasers, and that is, number one, you're going to need goggles, all right? That's part of PPE. And you have to make sure that you don't have any mirrors in the room. And you have to have posted signs, outside of the door to allow people to know that in that area that there is a laser in use, or that is the room used for laser. I actually never turned our signs around, by the way. Those rooms that were exclusively used for laser, that sign remained up. It was universal precaution, because what happens is if you turn them around, people forget when they go into the room to turn it back around. Right. All right. Would you want to mention anything about laser safety in an office?
Actually, the safest thing that you need to be doing with your lasers is removing the key when it's not in use. I can't tell you how many times my inspectors have gone into an office and on every report it says, please be sure to remove the key from the laser when not in use. And it just avoids, somebody using it inadvertently. And as you said, they could be dangerous. So yes, you have to have your proper PPE. Everything needs to be done according to the manufacturer's standards. So if you're going to have goggles, make sure that they're the goggles that meet the standards that the manufacturer states. You know, and it may mean that you have to have 2 or 3 or 4 different pairs of goggles or types of goggles. But you have to, and you have to meet those standards.
There's many different types of goggles depending upon the type of a laser that it is and what kind of fire it shoots, you know, what kind of a laser it shoots. And some of them have the shutter goggles and some of them don't. I urge you as a matter, this is coming from Jay, the safety guy. I can't tell you how many times I've seen Gorilla Glue or Super Glue with hand pieces for one of the goggles in, all right, and there's glue around the goggle, the actual lens itself. And I never understood why people are, you know, so shy sometimes to wear the goggles or get a new one instead of fixing the one that you have, because I parlay it to this incident. Why is it that you're so afraid to properly use goggles and you'll go cheap? But if you buy a $500 or a $1,000 camera, and I usually in my training, I do it like this. What is that black piece, that plastic that goes over the front of the, what's that called? And everyone thinks like, I really don't know what it is. And everyone yells, oh, well, lens cover, lens cover. I said, yeah, lens cover. I said, why do you put that on that camera? Oh, because I don't want the lens to get damaged. That's an expensive lens. And I said, but you could buy another lens.
Right.
Right? Why is it that you'll go on eBay or Amazon if the lens cover breaks to go find a new one, but you won't worry about getting brand new goggles, everything for the only one set of eyes that was given to us at birth?
Yeah.
You know, let's talk about healthcare consultants. You and I are both consultants, all right? Yet we do different things. I am a healthcare risk manager, all right? However, I'm not a risk manager. I touch the surface on what you need to do as a safety guy. What do I say? I say you need to hire a risk manager. You need to hire a universal healthcare consultants. I don't compete. When it comes time to accreditation, yes, I've been accredited 7 times with AAAHC, all 3-year inspections in our facility. Did I do it? No. I had a healthcare risk manager that came in and we had to go through all the drills and I had to sign off in the box in the front of the section that this was done, and my healthcare risk manager would help me, and we replaced all the information in the book as it got updated. And you know what I used to hear from my staff? Why do you let your risk manager treat you like that? They come into the OR and they pull all the charts unannounced. You know, she would come in and just say, okay, let me look at your surgery log. I want this chart, this chart, this chart, and that chart. You know, I didn't get any warning and I had to bring her the chart. And then she would go through the chart and write me up for everything that I missed. And then of course my staff felt accountable for that, right?
And then you have to pay her a check.
I'm sorry. And then I have to pay her for that. Right. I had to pay her for that. But she was very nice. She actually gave me 30 days to pay it. I didn't have to pay it before they left. Unlike some providers, independent contractors or anesthesia providers that you have to pay before they walk out the door.
Right.
I'm not knocking anesthesia providers. I get it. You go to multiple places. But some of my staff used to say to me, Jay, she writes you up for all these things. And then she has a meeting and doesn't berate me, but just goes about everything you did wrong. Why do you allow somebody to treat you like that? I said, do you realize, to my staff, that is the best money I spent, because that person is my coach. Yes, I paid her to find everything wrong before AAAHC fails me, before OSHA finds me, and before the bloodborne pathogens, you know, biomedical waste people come in and cite me. Now, maybe you'll look at it a little bit differently. So I'll give you a plug now. You know, we've got a little bit of time left. Is, do I need a healthcare risk manager like you? even for local procedures, all right? I'm only doing local tumescent lipo. Yeah, I'm giving them oral PO medications and anesthetics, but do I need a healthcare consultant like yourself, even for local, to check my drugs? I used to have pharmacy consultants actually come in too. Pharmacists would come in and check my logs.
Right.
Why do I need a risk care manager, a healthcare consultant like yourself?
You know, the simple answer is we're all pretty smart people. We're all educated, and yet we have accountants that do our taxes. We have lawyers that give us advice on other things. So why wouldn't you hire an expert when it comes to compliance and making sure that you are doing everything perfectly every day? I will tell you that one of the bigger reasons is reducing liability. You know, if something happens in the office, and we've dealt with everything from employees that have overdosed during a case to transfers of patients to a malignant hypothermia event. We deal with all of these different events, and our job is to make sure that it's handled correctly. The one thing I tell everybody is medicine is an art form based on science because everybody's different. My medical training is I'm a physical therapist. I've done gross anatomy. I've seen people with 3 bicep heads. There's only supposed to be 2, but they have 3. So everybody is different. Everybody reacts differently. That's why they have so many different antibiotics. You may catch a cold and respond without an antibiotic. I catch the same cold, but I need a different one. So what we have to do is understand that medicine is an art form based on science, number one. And things need to be handled in a proper manner. And if every event is handled in that manner, you're going to reduce your liability, number one. And that's on the personal side. But forget about the doctor, because truthfully, in consulting, I obviously am concerned about my clients, but I'm concerned about their patients. All of my cards and everything that we gear towards is patient safety. So a risk manager coming in and helping to create more efficient processes, explaining to the staff exactly what they need to do and how to do it, and providing that resource when they have a question. That's the most important thing. Now, I will tell you that we charge a fee, which everybody does, but I don't charge per hour. So my clients can call me up and they can ask me questions. They can call me 100 times a day. If I'm doing my job correctly, they're not going to, because they're going to be well educated and understand what the requirements are for what they're doing. But everything is geared towards patient safety. And that's why they need a risk manager, because it's another set of eyes. As a consultant, I hire consultants to come in and review my program, because I'm in the middle of it. You know, it's kind of like I'm in the pool. I don't see all the other things that may be going on around. And although it's my job to be on top of it, that's how I stay on top of it. It's also the surgeon's job and the facility's job to also be on top of the best ways of doing things, the best practices. And that's what we provide to them.
Good. I'll try and summarize that in 2 different quips here. Anyone that has ever attended our on-site live, and boy, do I miss that. Mara and I do 12, 15 conferences a year, you know, like every weekend is another one in another city, but that's been pushed off now since March. Probably won't get back until the beginning of 2021. But one of the first things I do open a conference with, it parlays back to what Rick said, is that medicine is a science. It's a way to heal the sick and injured, and in our profession is one of the ways to make you looking young and beautiful. In our industry, it is one of the most respected professions out there today. And why? You have to go through 4 years of college. You go through 4 years of a medical school. You may do a 1-year internship, a 3-year residency in a specialty, maybe a 5-year surgical residency, and then you might do another fellowship. And then, even though residency and fellowship is a job, I call it, and then you have to go out and get a job. All right, you know, opening up your practices, which you, Rick, and I, and Mara, all handle with all phases of the practice. People that are just coming out of their residencies and fellowships, or those who have worked for a seasoned practice and are tired of doing that and feel that it's now time for them to move on and open up their own practice, and that's why they call us to help them open up their business. And even though it's one of the most respected professions today, never lose sight of the fact that medicine is a business.
Mm-hmm.
And it's a business. And when we talk about that, what are the most important parts of the medical practice? And you said it, and you said it again and again and again. And Jay, the safety guy, says safety of the patient and safety of my staff is by far number one. And that's what this whole session today really, as we summarize it, dealt with. It's safety. OSHA is all about occupational safety and health administration. It's the acronym for the governing body, OSHA. But it really shouldn't be a governmental word, although it is. It really should be occupational safety and health activity, all right, because we administer that. And it's the protection of our practitioners' licenses, whether it's a doctor, a nurse practitioner, a PA, an esthetician, anybody that has a license, all right? And then I say, you have safety of your patients and your staff, and then you have your protection of your practitioners' licenses. I say, have fun. And with that, you'll make money, because safety and health is a business. And that's what we're in this for. Nobody is in this profession for free. If that's what you wanted to do for free, then you would work for the Peace Corps, and you would do this all voluntary, and you wouldn't. Now, a lot of us do pro bono work. A lot of us, you all go out there and you'll do a lot of these surgical cases in different countries, and even in our own country on mercy missions. And that's great. But at the end of the day, we're all in this to make money. So as we wrap this up, Rick, tell us a little bit about your company and how can somebody get a hold of you? Let me give you that plug right there.
All right. Well, thank you. And Universal Healthcare Consulting, we've been in business for 20 years. We are a national company. We service all types of outpatient surgery centers and ambulatory surgery centers, interventional radiology, interventional pain, endoscopy centers, plastic surgeons' offices, and some med spas that provide services as well. We do have a cloud-based platform. If I may say, I am very proud of the fact that during this pandemic, we have now performed 2 virtual accrediting body inspections, where we're here based in Florida. One of the clients was in Portland, Oregon. Another client was in New York, and the inspectors, one inspector was here in Florida and one inspector was Chicago, and we did everything virtually.
So you play the guitar? Do you play music for them during the inspection?
If you go on the website on our demo, you'll hear background music. Actually, we are a couple of musicians there. If you call the office, you'll speak to Jamie, and he's actually a very well seasoned musician. Bass, guitar, sings, and he owns a studio as well, and is part-time. I don't.
Great.
Jay, are you going to admit to Rick that you used to play guitar as well?
And sing.
I
will profess that at one point in time in my life, I think I was a pretty darn good singer. Not just a karaoke singer. I've gotten up. I can sing. But let's go on. How does somebody get in touch with you, Rick?
Okay, so the easiest way is 561-999-9371 is our phone number. That's 561-999-9371. If you are out of state or in a different time zone, if you call at any time, you will be answered. Or
how about a website?
Sure. Our website is universalhc.com. And you can also email us at info@universalhc.com. Perfect.
And if anybody needs that information, again, actually, we'll be more than happy to put that up on our website with this webinar. And we'll also be able to put you in contact with Rick. We're working together. We're working on certain things. I will tell you that in the 20 years that I was in the plastic surgery practice, I will tell you that I had a risk manager and healthcare consulting firm the entire time. If for nothing else, Mara sent me a very interesting quip today, and it was, I think it's Seth Rogen, blog or something like that. And it was about, do I want an inexperienced pilot flying my plane? All right. I mean, if I was going to be on an airplane, somebody says, who do you want to be your pilot? And it was always Scully. All right. Why? Because he was that experienced guy that knew how to fly it? Do I want a new builder building my house? All right. Well, as I say, you want experienced people and a coach to help you with your business. And that's what Shorr Solutions does. We provide more than one solutions. That's why it's Shorr Solutions. And that's why you have Universal Healthcare Consulting as accrediting OR consultants as well. Mara, take it away.
Absolutely. So now that these fine gentlemen took the bulk of the education, I come in at the very end and wrap up in my moderation duties. So one thing that I do want to share, because we get this question a lot, is that if you are craving additional education from Shorr Solutions, we do have additional upcoming webinars that if you loved hearing Jay on this webinar, you are in for a treat because there is always more where that came from. So we encourage you to check out our next free webinar, How to Launch the Most Powerful and Profitable Presence for Your Practice. Say that 3 times fast. That is going to be with Advice Media's Darren Siegel. And if you're looking for others, go ahead, see our website, which is what I'm trying to say, shorrsolutions.com. You can see our website at the bottom of the screen. We do have a page specifically for webinars. So shorrsolutions.com/webinars, and you can see all of the webinars that Jay has lovingly hosted and shared all of his brilliance. And then here, you can also see we have a podcast series. So Shorr Solutions, the podcast. We love a good brand. So we encourage you to listen to our latest episode, which this week is How to Make Money While You Sleep with Sam Peak from Incredible Marketing. And we have, I would say, a few dozen, by the time you listen to this, we'll have a few dozen episodes as well. So you can hear from all sorts of brilliant folks. And I would be the one that's hosting that. So the next thing we want to make sure to talk about is that if you are on this webinar, and you obviously are, if you are hearing my voice right now, I want you to go ahead, take advantage of one of these free offers. So this is your free gift with zero purchase for this webinar because it was also free. So for a limited time, we want to offer help for you. Pick from either a free marketing calendar, a free credit card processing analysis, or free patient financing registration. So send us a note. You could see our email address is right here. You can also see, again, our website, phone number here, and then again, we have all of our social handles, Facebook, Instagram, etc. So we are at Shorr Solutions. So with that, that wraps up today's episode of Shorr Solutions, the webinar.
We got it in, thank you, Mara.
Right on time. We got it right on time.
We got it in 1 hour. It's almost like we've done this before, right?
Once or twice.
No, once or twice. But Rick Conn, co-founder and CEO of Universal Healthcare Marketing, I can't thank you enough for giving us your pearls of wisdom. I know we have spoken many times. And I really appreciate you taking the time out of your busy day to really help the listeners understand OSHA, understand what's required. There's so much more. And I urge people to take advantage of it. Call me, call Rick. We're more than happy to help you. It's not always about a fee. If you have a specific question that you have that you need answered, it's burning inside, pick up the phone and call. It is our goal to help people help themselves. With that, I really want to thank you, and I'll say goodbye.
Thank you.
Okay. Absolutely. So
thank you very much.
Any information? Here you go. Thank you so much for joining us on another episode of Shorr Solutions, the webinar.
Thank
Bye,
you.
guys.